Hi there, my name is Dr. Khalid. Today I'm going to talk about the antibodies response after the vaccination. There are two categories. Number one, those who were having COVID 19 infection and those who were not having any COVID 19 infection. It has been observed that the response was different in those who were COVID 19 positive and those who were COVID 19 negative. The amount of antibodies in those individuals who were positive was quite high after the first dose, and the response of antibodies was reasonably low in those who get COVID 19 vaccine and were negative. So that means negative people had a lower response, but positive people had a higher response. And it was observed that even it was like 10 times than those who were not having exposure to infection. This raises important questions and answers also some questions too. And this was also observed along with that the seropositive also had more symptoms like fatigue and headache. The researcher actually now suggests that long-term follow-up is needed to know how long immunity will last. So we still don't know that in seropositive after the vaccine, how long the immunity will stay, and in seronegative after two doses, how long immunity will stay. However, one question answered or suggested it has not yet been approved is that does it need one dose in those who are seropositive because 10 times more response is seen? It will help to save one dose and that can be used for others who were eligible candidate and also free up from paying for the second dose. Keep it in mind while talking of this second dose and positive response that convalescent plasma treatment strategies were not very successful and many of the studies could not give the positive results. Another question was commonly raised in our frequently asked questions after the vaccine: does it causes the infection? 4,100 patients has been observed, and these were the healthcare workers in one of the hospital, and they received the Pfizer biotech vaccine, that is messenger RNA vaccine, in which there is no particle of the virus. 0.54% were diagnosed with COVID-19 infection in 1 to 10 days after the vaccine. Researchers reported this in emerging infectious diseases. Roughly two-thirds had COVID 19 symptoms such as fever, chills, cough, headache, myalgia, and sore throat. Half the cases noted community related exposure, including four of them were having the infection at the same or exposure on the day of vaccination. It gives an important suggestion for the clinician that the post vaccination symptoms should not be ignored simply and relate to vaccine only. COVID 19 tests should be done or prompted. Estimated median vaccination rate had been 78% in eligible residents. Among staff was only 38%. And surprisingly enough, 63% were women. So the researcher needs to and suggests that the focused communication and outreach approach is needed, and more explanation and confidence need to build among the healthcare worker too.